Hi there. My name is Dr. Juliane Pariz. I am a family and child psychologist and PCIT therapist here at Drop of Life. And this presentation is to introduce you to the parent and child interaction therapy, which is a modality of treatment for young children and their parents I offer here at Drop of Life. In this short presentation, I'll walk you through learning what PCIT is, who PCIT is for, who are appropriate caregivers for PCIT, what are the expected outcomes of PCIT, how does PCIT work, and types of PCIT. Let's start with learning what PCIT is. Well, in its origin, PCIT has been developed in 1970 by Dr. Sheila Aberg in the US. And she did that based on a series of relevant scientific knowledge from theories such as attachment, behavioral modification, parenting styles, social learning, and coercive cycle. Nowadays, PCIT is an evidence-based treatment. This means that it has more than 30 years of research showing its efficacy to help families that have children aged 2.5 to 7 with behavioral or emotional difficulties. But to what population is PCIT designed for specifically? Well, PCIT is indicated for caregivers with children aged 2.5 to 7 who have serious emotional and behavioral difficulties. Such difficulties may include biting, hitting, defiance, and refusal to follow instructions and rules, temper tantrums, meltdown, whining, destruction of property, throwing objects, aggressive behaviors, difficulty playing with others, sharing and take turns appropriately, etc. In addition to the difficulties I just listed, PCIT is also indicated for families whose child has received a mental health diagnosis, such as adjustment disorder, ADHD, depression, anxiety, PTSD, ODD, which is oppositional defiant disorder, or ASD, which is autism spectrum disorder. Importantly, you hear me emphasizing that PCIT is for caregivers and their child. So let me clarify to you that appropriate caregivers are any of the following: biological parents, foster parents, adoptive parents, legal guardians, grandparents, or kinship caregivers. Next, I want to tell you more about what research has shown families can expect after they complete PCIT. There are specific outcomes for the child and for the caregivers, and I'll present them both here for you. Let me tell you some of the outcomes that can be expected for the child first. These are outcomes that can be expected for after the child completes PCIT. On the slide, the blue arrow indicates a decrease and the orange arrow indicates an increase. Thus, for children, a decrease in child's non-compliance, activity level, disruptive behavior, negative attention-seeking behavior can be expected. At the same time, an increase in child's attention span, self-esteem, positive social skills, security, and attachment to the caregiver can also be expected. Now, let me tell you some of the outcomes that can be expected for the caregivers after they complete treatment with PCIT. Again, on the slide, the blue arrow here indicates a decrease, and the orange arrow indicates an increase. Thus, a decrease in caregivers' experience of frequent and severe child's aggressive and disruptive behavior, and child's defiance, and parental stress can be expected. At the same time, as indicated by the orange arrow, an increase in child's listening to caregivers' consistency, child's respect for house rules, child's public behavior, calm and confident in managing child's behavior can also be expected for caregivers. Now that you know what PCIT is, who is PCIT for, and what to expect after completing PCIT treatment, let me quickly walk you through how PCIT works. PCIT works mainly with life coaching. In this modality, the therapist coaches the caregiver on using the PCIT therapeutic play skills with their child during sessions. The advantage of coaching parents live in sessions are many. Among them, in-session practice means that caregivers acquire PCIT therapeutic skills more rapidly. Also, therapists provides caring support as caregivers gain confidence and master their skills. Finally, therapist provides immediate feedback about strategies to manage the child's challenging behavior during sessions. Here's how it happens. The PCIT treatment consists of 2 phases, and these phases are delivered over 12 to 16 sessions. It varies from family to family. In phase 1, which is called Child-Directed Interaction, or CDI for short, we work on developing and acquiring the PRIDE skills. PRIDE skills is an acronym for the 5 skills that are practiced during this first phase. And the 5 skills are named praise, reflect, imitate, describe, and enjoy. Since phase 1 is where we will have built a foundation to enhance the caregiver's child's trust and relationship, phase 2 is where we build on those skills to use effective commands and discipline procedures to manage their child's behaviors in many settings. So phase 1 is called Child-Directed Interaction, CDI, and phase 2 is called Parent-Directed Interaction, or PDI. More specifically, this slide here shows the step-by-step of PCIT treatment from start to completion. Importantly, once you start PCIT, its expected outcomes can only be achieved if caregivers commit to completing phases 1 and 2 in full and up until graduation. So PCIT only works if it's completed in full. For that reason, it requires commitment from the family and from the child. So it starts with assessment, then there is a teaching session about phase 1, then phase 1, then a teaching session about phase 2, then phase 2, and then graduation. At Drop of Life, 2 types of PCIT are offered. Parents can choose between in-room PCIT, where therapist delivers live coaching of caregiver-child interaction skills in an office-based setting here at Drop of Life, or parents can also choose to do it online, which is called iPCIT, where a therapist provides live coaching of caregiver-child interaction skills using a video link into the family's home. Thank you for watching this presentation until now. If you liked PCIT and you think that PCIT applies to yours or another family you know, please contact us or tell them to contact us at Drop of Life for more information and to schedule an appointment with me. It'll be a pleasure working together. Take care.